So let's have a conversation about our health. And I want to begin with a story. When I was 18, I landed my first real full-time job. And so I wanted to make sure that I was responsible and all of that. And so I always made sure that I was on time and worked hard and all of that. But at the time, at 18, I still wanted to have that partying lifestyle. So I would go out at night and I'd stay up to 2, 3, 4 o'clock in the morning and then show up for work on time at 8 o'clock in the morning. And there were times when I'd even spend a night in my car and get up in the morning and go to work, as crazy as it might sound. And so one morning I woke up, and as I was taking a shower, I noticed a little twinge in my chest, which kind of felt like a little muscle cramp. And so as I'm bathing, I did this number, and I went, oh! And I just kind of blew it off and didn't pay attention to it. And so I went to work, and I was working at a lumber company. And so I'm at work, and I'm loading up these 2x4s. And so I'm grabbing these 2x4s, and I'm putting them in this rack. And I reached down, and I grabbed some 2x4s, and I went to do like this. And all of a sudden, it felt like somebody took a 12-inch knife and just jammed it in my heart and just twisted it. The pain was so intense that I literally just blacked out and fell on the floor. And so when I came to, I was on a stretcher, and they were taking me to an ambulance. They're going to rush me to the hospital. And my entire left side was numb, and so I figured that I probably had a heart attack. Now, that was kind of confusing because I worked out. I was in pretty decent shape, and I couldn't understand how my heart may have been defective or something. So anyway, they put me in an ambulance, and as we're driving along, the guy's got me hooked up with EKGs, and the guy tells the driver, he says, well, this guy's heart's fine. His heart's beating just no problem. So he told the guy he didn't have to rush through with the lights and all of that. So I get to the hospital, they hook me up with more EKGs, the doctor comes in, and the doctor says, okay, tell me what's wrong. And I said, you're the doctor, you tell me what's wrong. And I said, did I just have a heart attack? And the doctor says, no, you didn't have a heart attack. And I said, well, what the heck happened? And he said, well, that's what we need to figure out. And so he started asking me some questions, and I was kind of skirting around the whole issue. And then I finally told him that, I wasn't sleeping very much. And he kind of smiled and laughed at me. He says, oh, okay, now we know what the problem is. And he said, here's a prescription. Go home, take these pills, and you'll be fine. So he gave me some muscle relaxers and some sleeping pills or something, I don't know. But what happened was my body was so tired that the muscles in my chest literally cramped around my heart. And when it contracted, it shut off the blood flow from my heart, and it mimicked a heart attack. But it wasn't a heart attack. It's just that the muscles around my heart just cramped. And so the guy gave me the sleeping pills and the muscle relaxers, and I went home, and I slept for 27 hours straight after taking that medication. Now, a couple of days later, when I went back to work, I had a whole new appreciation for the human body. Because to me, I'm thinking, no, wait a minute. My body is actually smarter than I am. Because my body knew that I wasn't going to stop, so my body decided to stop me. And it fascinated me, actually, that the body could do that. And from that point on, I've taken care of myself physically. Don't drink. Don't smoke. Take very good care of my body right now. Go to the gym. Exercise. I believe in meditation. It's really important that we, especially as men of color, make sure that we're taking care of our physical body. And so that experience was a wake-up call. And so now I'd like to give you a wake-up call and ask you, are you taking care of your physical body? What are you doing right now to ensure that, number one, you don't end up like me, or unfortunately too many people with a heart attack or some sort of disease? What are you doing to make sure that you're taking care of your physical health? Now, here's an interesting paradox. When you look at the major sports and you see black men, what you generally see is black men epitomize the perfection of the human body. I mean, it's absolutely amazing when you look at how we as men of color physically are so amazing. But the paradox is men of color in this country actually lead the nation in most health-related illnesses and death, which basically means we aren't taking care of our physical bodies. And so it's important that we make sure that we begin doing this. And so I want to just break down a couple of things that we must be willing to do that can support us in this. First of all, it is absolutely imperative that you get an annual physical. It's real simple. What you don't know can hurt you. But if you do know, you can fix it. So don't use that as an excuse, well, I feel fine, not to go. Because there's a lot of people that unfortunately feel fine and then they're dead. I don't want that to happen to you. So make sure that you commit to going to the doctor at least once a year. When you do that, 3 primary things that you have to watch. Number 1 is your weight, your blood pressure, and your cholesterol level. You see, if you know what those 3 things are, if you know if you're overweight, which is what is fat? Fat is simply the body's way of saying I'm taking in more energy than I'm burning off. So if you know that you need to burn off some weight, then it's important that you do that. Understanding your weight and what your ideal weight is your responsibility. Next, your blood pressure. It's simple. You put the little thing on your arm. The doctor checks to tell you if your blood pressure is elevated. High blood pressure is rampant in our communities. And it is imperative that we make sure that we're lowering that blood pressure and making sure that it's normal. And it's a simple test that you can do for free. So you got to make sure that you know what your blood pressure is. And next is your cholesterol level. Cholesterol being the little fatty stuff inside your arteries. When your arteries get clogged, it's because of cholesterol. If you clog those arteries, blood can't flow. Next thing you know, you're having a heart attack. So you got to know what your cholesterol level is and make sure that if it's high, you want to bring it down. Our health is our individual responsibility. No one can take care of your body except you. It is your responsibility to take care of your health. You got to do this. We have to do this, especially as men of color. We got to take better care of ourselves physically. We got enough external challenges out there, so we must take care of the internal challenges which no one else can do for us except us. So make a commitment to your physical health. And if you do nothing else, after watching this video, make an appointment to see your doctor to figure out if there's anything that you might need to change in your life. Okay? Commit to your health. Love your body. It's the only one you've got.